All right, good afternoon, everybody, and welcome to the Marlborough Hospital Town Hall for November 7th. Just want to let everybody know that we are recording this presentation so we can put it online later. If anybody has an issue with that, just let us know, but that's the process that we do follow. So we're going to go through a little bit of the update. We're going to talk about a cause for applause, then go through the year in review for 2023. Talk through the True North metrics, balance scorecard, some capital improvements, talent acquisition, the change of the hospital service, and then talk a little about the finances. And then we will review the 24 goals and what's going on as we come into the winter months and going into next year. I'm going to turn it over to John, who's going to walk you through the first section, and then he'll press it back to me, and we'll go from there.
All right, good afternoon. So as we always like to start off with some good news, we have some terrific pictures here to share with everyone, and these are some of the celebrations that we had last year. We had, when we talk about last year, we do talk about last fiscal year, so from the beginning of October 1 to the end of September 30th. We had a Wear Pink Day, we had a little free library day, cause for applause, and Amber got to retire, which it was fantastic for her. She is, if anyone's interested, she's having a fantastic retirement, and she says she wished she had done it sooner. So we can all take that to remember that. Lots of rewards being out in the Grangers too, in combination with terrific work by EVS and Giovanni's unit celebrations, which has been a big hit. We recently celebrated Facilities Week. We've, thanks to Pauline and her leadership, and Mary, we've had some terrific skills day. Thank you for all the staff that helped out with those to make those successful. Just so I don't have to search through the list, please mute yourself if you're not talking. Thank you. Next up, we did some food presentation with medical staff services. And then you can see we had some radiology celebration as well. And, lots of evade training. So thank you to everyone that's done the evade training. As of January 1st of 2024, this is mandatory for everyone to have done evade training. And then, the level 2 and 3, lots of areas have to do that. So thanks again to Pauline and Mary for really getting this done, and it's a huge undertaking, and I know we've already educated a couple of hundred people, so great work. And as we'll move on to Halloween, which was just a week ago today, and hope everyone had a great one. And then the last slide there is we did visit John from security last week, who was just a tremendous asset to us and really helped out with a patient recently. So lots of good things have been happening. So thank you, and we don't have time to hit all the highlights, but there are a lot of really great things happening here, and we're greatly appreciative for all of them. And just this goes out to all of you, and just to know that we do get a lot of cards and things sent to really thank you all, the caregivers, for the work that you're doing. You really are impacting lives. You're making a difference with how you care for them, how you treat them and their families, and it does not go unnoticed. Every month when we have a board meeting, we do share these notes and other great stories of compassion and care and people getting better. I just ran someone in the hallway a few minutes ago who says that we did a fantastic job taking care of him, and that the care here was great. And he said it just wasn't my care. He said it was all the care of all the patients that he came across. So what you're doing really matters, and thank you. All right, now on to more of the business of things. So here's our scorecard for the year. I will go through these a little bit quicker. Our fiscal year has ended. Some of the metrics are still getting updated because they do lag behind. And inpatient mortality is one of the metrics that we follow, and we did not hit our target this year, a little bit higher than we had been in previous years. And a lot of that is just related to the patients that are coming into the hospital, the increase in our ICU census, as well as being able to transitions patients into hospice when they, that are dying. And unfortunately, a lot of that work is, done in the last minute. But we're doing we're doing what you can. We're looking for, kind of continue to improve that process. PSI 90 is a patient harm score. I'll just jump down to patient harm events, and congratulations everyone on having less harm events than we did last year. Ideally, we'd like this to be 0, but we did have a total of 11 harm events this year. And just so people understand what they are, these are, like CAUTIs, central line infections, We did have one fall this year where the patient, had a fracture that was a serious safety event, C. diff infection. So these are the kind of things that are captured here, as well as a couple DVTs. So great work on having it less than last year. We follow our readmission rate. It's not a target, but it's, we're right around where we ended last year. And I do have a slide on our willingness to recommend, which I'll just take a moment to talk about momentarily. Here's our falls information. So congratulations on having less falls and everyone's attention to this. We had a total of 109 falls this year versus 125. I feel funny congratulating us on this, but, we do look for driving improvements. And a unique thing that we do at Marlborough Hospital is we count all the falls. So even the ones that other hospitals wouldn't count, behavioral health falls or falls that are in areas that aren't, kind of publicly reported, we do count because we're always looking for ways to improve. Out of those falls, 21 injuries, all except one of them were minor injuries, and an injury can be considered even pain. We did have one fall with a fractured hip, and that was horrible to have happen, to have someone come to the hospital and end up more injured than what they came in as. So other than that, the rest of them were minor in severity. Patient experience slide, and this big graph right here shows some of the different areas of focus. We do follow likelihood to recommend at Marlborough Hospital as well as a system. We did not hit our goal this year. It's at 57.7. But what I do want to just highlight are a couple things. Likelihood is a combination of many things that happen, many scores they're rolled up to combine likelihood to recommend. But some things that we do control, and we did have significant improvement in them, are communication with physicians, communication with nurses, and responsive to the hospital staff. And I just want to thank you for that work. Normally, when we have improvements in likelihood to recommend, normally when we have improvements in nurse communication, physician communication, responsiveness to staff, our likelihood to recommend goes up. This year it did not, which is unfortunate, but usually those are key drivers and do drive that score. So nationally, the likelihood to recommend score has fallen. So while we didn't hit our target of 60, it's not as bad as the numbers, without kind of the story behind it. So thank you for your continued work around communication and your responsiveness. The one thing I am going to say is that, our scores did fall significantly in Granger 1 this year, and normally Granger 1 is something that really helps us maintain and improve our scores. So we're doing a deep dive into Granger 1, understanding what changed there to why our scores there fell. It's certainly an area that we want to fix and correct. But thanks for all your work and continued support. And this is very important. And the patient experience rolls up into a lot of other publicly reported metrics. I'm going to hand it over to Steve here in just a moment after this slide. This was capital improvements. So this year we spent around $1.5 million on equipment and things throughout the hospital. And, every year we have, on good years, we have about this much money, and it's really excellent and awesome to be able to put money back into the things that you guys need. So please speak up to your managers about equipment that you need to make sure that we're really reaching you with the money that's being spent. I'm not going to read everything. I'm not going to read anything actually, because I know you can all read, but these are things that we've ordered, and many of them are in. There's a few things we're still waiting for. An example would be the 20 new beds. But we begin the whole fiscal year again. We don't really buy any capital prior to January because we need to see how the year is starting off and understanding where we're going. But we do start collecting the list, so please speak to your managers. If you're a physician, please reach out to your administrative partner and let them know of the equipment you need so we can get it submitted for consideration and approval. I'm going to hand it to Steve now to keep working through.
All right, so I'm going to just go through a little bit of an update around talent acquisition. If everybody's heard, we've had a lot of effort in this area. We revamped the process, and we're working on some new marketing and communications for that throughout. So as we get into it, while the TA process is actually, this is the system scores, is doing relatively well overall. So in fiscal year 23 through September, we've added 632 additional caregivers. That is the net between those we've hired from external versus separations. Unfortunately, we've actually had a little bit of a different story here in Marlborough. We are down from We've only had 98 external hires compared to 124 separations for a net 26 negative. There is some good news in the short term. We do have some additional recruiters being assigned to us, which should hopefully work to get some more people into the pipeline. But for those managers on the line, it is also very important for you to complete the process for HR. We are only at 40% getting reviews back on candidates within 24 hours. So we need to make sure we are speeding that up so that they can make offers, because in the market that we're in right now, if you like somebody, you make the offer today, no matter what, because it's all about time and the ability of that person to have other opportunities in the market. So another thing that we took on this year, we did welcome a new hospitalist team in September, Apollo MD. Right now, we really only have about 2 full-timers in that group. The rest are being comprised of locums. We are working with Apollo on their recruitment plan, and they've got some people that they're in discussion with to come on board over the next 3 or 4 months, with the expectation to get up to about 8 to 9 full-time providers here in this, which will, at the end of the day, when we're up and fully staffed, we'll have some significant improvements for the hospital, both on process and quality. But certainly with any new program, it's going to take a few months to get to that level, but we are working with them, and we have calls every Wednesday with their team to make sure things are in process and moving forward. So a little bit on volume. We do not have financials in here, and the reason we don't have the financials in here is that we have not closed the financials for the year. The audit process is just kicked off about a week ago, and that will take about 4 to 6 weeks, so we won't get final financials for the year until probably in the December timeline. But you can just base it based on how our volumes go, and I can give you some anecdotal views of that on the inpatient and the psych side. Obviously, on a year-to-date comparison, we're up between 5.6% on the acute side and 4.5% on the psych side, which is great news. We have ER volume being up 0.6% for the month of September. Inpatient cases are being up, as well as endoscopy. But what's really important is when you look at year-to-date, we're still about 6% up on the acute discharges and 4% up on days in behavioral health. We're up 11% on observations, 5% in the ER, down a little bit on the inpatient OR cases and outpatient OR cases, but way up on endoscopy and colorectal cases here. So overall, you can look at the volume trends. We're doing very well. Certainly, there's some good positive movements in the market, and we totally understand that creates some stress on the staff and the teams in the front end, and we are working aggressively to help in any way we can around that. So Dr. Dixon likes to share his long-term strategy for UMass Memorial Health. I'm not going to read through all of this process, but as you can see here, we always break it down to patients, the community, and the people. We do the same thing with all of our goals for the organization, but what we're trying to focus on is making sure we have access. We have great innovation. We're all doing the idea boards, moving things forward, coming up with new ideas of how to do it in the current economic market, making sure we're utilizing all of the sites of care that we can. We're in the process of bringing out some of the surgery teams from UMass to Marlborough in the next, actually in October, November, and December, and hopefully we'll get some more volume out of that here. And that's focusing on some underutilized resources. And then overall, we're trying to focus on community health and the total health ownership of what's going on in the market. We do partner with the ACO to get here, but we're also leveraging that with some efforts through Anchor Mission in the community, and making sure we have food access for a lot of our patients in the community, so that and we know it all starts with housing and food. If you're hungry and you have nowhere to live, your focus on your own personal health is very low. So from some of our priorities as a system, we obviously want to provide the highest quality, safest, most equitable patient-centered care to all of our patients. And we're going to meet that promise by focusing on the following 3 actions. The first one is on people. We want to recruit and retain as many as we can. We talked about the TA process. Obviously, we're going to continue to monitor that, but we also need to be actively engaged with this. So we do have lots of referral bonuses for people if they can refer caregivers to us. These are not small dollars for referring certain roles to our facilities, and you can get that right in your check. Then we're focused on the community, making sure that we're addressing what's going on with the social drivers, the health disparities in the community, and utilizing our community benefits and anchor mission programs to be out there and active in the community and be a member and a partner in our communities. And I'll talk about one piece of that at the very end that we have going on. And then we always want to be focused on the future. You know, at the end of the day, good, bad, or indifferent, you know, hospitals and healthcare is a business. And at the end of the day, we need to generate a bottom line income so we can make investments both in our facilities and in our people and in the communities we serve. So, you know, we do need to be, unfortunately, very focused on the financial outcomes, but we also need to focus on the quality and the value we're providing back to our patients. And we're doing that through leveraging on our digital health programs, some specialty pharmacy programs, et cetera, throughout the system. And we have a lot of opportunities there across the system, and we are focused on this, and this is what our goals are based on. So going into 24, what else is going on? We have a little project coming out in the near term here called Workday. I believe the majority of people have been seeing a lot of emails come across their desk around what is changing, how it's changing, and I'm not going to go into detail around that. There will be a lot more to it, and depending on what role you have in the organization, there will be some online training as well as in-person training for those who will be utilizing Workday on a very aggressive amount. So there is a lot behind here. One of the things I do want to highlight is we have gone away from UMatter Central. We will be moving to a program within Workday. The first program in Workday will not be a social posting where you can recognize your caregivers. It's only for the economic side. Under UMatter Central, we were giving out gift cards or points towards gift cards, and unfortunately, if anybody understands those programs, about 30% of the gift cards go unused, so the only person who benefits is the vendor who's sending it out to us, because if it doesn't get used, they take that as profit. Under Workday, these will not be gift cards. They'll actually be cash going into your paycheck every time you get one. So you'll get immediate payout on those on a regular basis. We are looking to bring in a social network that will allow us to recognize other caregivers and coordinate that with Workday, but it will not be live or in place as we go live with Workday in January. There's a lot to it, but Workday is not panacea. It's not going to fix everything, but I will tell you, based on our historical data sets and what we utilize here to make decisions, we are moving from what we older people call green screens. It's computer systems from the early 90s. And that is what our HR and purchasing systems are based on today. We'll be moving away from that to a fully integrated high-end service with Workday. So we can't wait to bring that online. Certainly there's going to be a learning curve, somewhat like we did with Epic, maybe not quite to that same degree, but hopefully we'll see the same benefit at the end of the day. As we move into the holidays, we do have the season of giving coming up, and we have partnered with Kits for Kids and the Marlborough Community Cupboard for the season of giving. So we are looking for non-perishable food item donations and other items that can be used for the Kits for Kids. If you're interested, there are donation bins located throughout the area. And some of the items that they're looking for are in the flyer, as you can see below. They're looking for gift cards, shampoos, conditioners, hand sanitizers, socks, which is very important as we get to winter, as well as basic sanitary goods. So there's a lot of opportunity here, and I hope everybody takes a chance to help them out. And here's a final piece I'm going to touch base on, and this is what's going on in our community, and not just our community, but the communities across the entire state of Massachusetts. This is front and center in most of the newspapers and news articles online. It's what's going on with the migrant and homeless families in our local areas. We know there's a lot going on. We currently have almost 600 total individuals in these programs. Right now, they're in 3 different facilities, and I know the state's working to combine that down to 2. because I do think it's probably a little bit better for them to manage the social services in those, having less spread across the community. But certainly this creates a lot of challenges for us, both for, just understanding the needs of this population, but also for this population who is coming into our ER. And unfortunately, good, bad, or indifferent, being migrants, they are concerned about giving out accurate names and information on location because they're worried about being deported, even though technically it's a legal situation right now and they are covered, but it's definitely a concern for many of these people. So we are working with both the local Department of Public Health as well as the state to try to get some better coordination on this. I can't promise we'll be there soon, but we are actively engaged with them to make sure that we're meeting as much of their needs as we can locally. So we are going to move it over to questions, and I know I saw Ellen put in the chat window that if anybody has any questions, please enter them in the chat. John and I will hang on, and please feel free to enter them here, and we'll answer anything you all want to know. Not hearing any so far, not seeing anything put in there. It is, who's the brave soul who's going to ask the first question? All right. Oh, do you have more information on the reason for low care transition scores? Patient visits.
I mean, I have, Mary, you probably have the same information that I have. It's that people aren't happy that they end up getting, they ask for, they're given a selection of places to go, and then usually those places either are full or, they're not able to go there based on their insurance. So we offer a bunch of different places, but they end up kind of being, sent to a place that has capacity or is an insurance reason. So that is a challenge.
Yep. So Ellen did put in a reminder for us, get your flu vaccines. You can get them here through Employee Health. The deadline for that is December 1st. So if anybody gets a chance, it's probably the best way to defend against the flu. And this is important for us to protect our patients and our staff. All right, I'm not seeing anything else in there. All right, well, if you don't have any questions, feel free to, start logging off, but John and I will hang out for a few more minutes in case any late straggle questions show up. Otherwise, we just wanted to say thank you for all your efforts. Glad we have the opportunity to work with all of you. And as we come close to the holiday season, I look forward to having some opportunity to celebrate and enjoy the holidays with each of you. So we will be in touch soon.
Thank you.